Hi, I'm Ian from Boys and Girls Club Worcester. I do the first aid and CPR certifications here. Today I'm going to give a demonstration on some of the basic skills for CPR. This will cover rescue breathing and chest compressions, as well as your primary survey. The exact way that you would perform these skills will depend on what type of certification you choose to obtain, but this will be a bit of an overview for you. The first thing is always going to be to check the scene to see that it's safe for you. Try to get any clues as far as what might have happened to the person. Second would be to try to determine if they're conscious. So you're tapping them, calling out, "Are you okay?" You want to make sure you're loud so that you can wake up somebody in case they're sleeping. If you don't get any response, that means that you have to determine what is wrong with them. Make sure that 911 has been called. Whatever care you're going to be giving is just going to be adequate until the EMTs get there. So it's vital that they're on their way as soon as possible. So depending on your level of certification, some certifications will tell you to scan and look for signs of life, see if the chest is rising. Some will ask you to open the airway, to look, listen, feel for breathing, and to check a pulse. Depending on what level of certification you have will determine exactly how you determine what care you give. Whatever you do, you're not going to do it for more than 10 seconds before you begin giving care. If you determine they need care, if they need chest compressions, you're going to give 30 compressions. Go in the center of the breastbone using the heel of your hand, interlock your fingers, keep your arms straight, and use your shoulders to go straight up and down to give compressions. You're going to give 30 compressions, and then you're going to come and you're going to give 2 rescue breaths. Again, depending on your level of certification, you may have a breathing valve that you're going to use. If you use that, you're going to make sure that it's secure and that the airway is open. That way the breath is going to be able to come in. If you don't open the airway by tilting the head all the way back, somebody who's unconscious, their tongue is going to fall back into their throat, and even if you try to give that breath, the breath won't go in. If you don't have a certification that requires one of these masks, you're going to pinch the nose, tilt the chin back, and give the breath directly into the mouth. When you're delivering the breath, you want to make sure that you're watching the chest to see if the chest clearly rises. If the chest does rise, that means that the breath did go in. Once you see the chest clearly rise, you want to stop giving the breath. Right? Depending on what size victim you have, if you have a child, you're not going to give a full breath of air to the child. That will be too much air for their lungs. So as you're watching the chest to clearly rise, that will determine how much of a breath you're supposed to give. Right? And you're going to continue. If the person has no pulse, no breathing, you're going to continue with the 30 compressions, 2 breaths, right? And you're going to continue with that for at least 2 minutes. Hopefully the EMTs will be there by then. Right. Some of the differences that you may have in dealing with an infant, again, depending on your level of certification. If you're checking for a pulse, you're going to check on the arm of the infant, not the neck. When you're checking for consciousness, you're going to check by blowing in the baby's face. You can tap the baby's feet, try to get a reaction that way. And when you're giving compressions, you're going to give compressions using 2 fingers. Again, center of the breastbone, 2 fingers, and you're only going to compress about 1.5 inches deep as you're giving those compressions. When you're giving a breath, if you have the mask, you're going to put it upside down and cover the baby's entire face. Again, making a seal. You're going to only open the airway a little bit for the infant. The infant does not need to go all the way back. Just a slight tilt of the head will be enough to get the breath in. If you do not have a certification that requires the mask, and you're going to give the breath, you're going to give the breath covering the mouth and the nose as you make that seal. Again, watching the chest to make sure the chest is clearly rising. Just keep in mind the baby's lungs are going to be very small, so it's going to be just about a puff of air is going to be enough to make a baby's chest rise. The cycle is going to be the same, 30 compressions, 2 breaths. 30 compressions, 2 breaths. If you have a baby that is conscious and is choking, there are different ways that you can do it, but the main way that you would do this is you're going to put the baby on your forearm, roll the baby onto his stomach. You're going to give 5 back blows. Keep your forearm on your leg, making sure that the head is lower than the stomach. You're going to give 5 back blows. Roll the baby over. Give 5 chest thrusts. Again, making sure the head is lower than the stomach. When you give these compressions, you're trying to compress the chest and the back at least 1.5 inches, and you are trying to force the air out of the lungs to try to help the baby cough. Whenever you're giving care to somebody who is conscious, you need to have consent or permission from that person or from that child or baby's parent or guardian before you can give care. Be sure to let them know what certifications you have, what training you have, that will encourage them to allow you to give care if you tell them you are certified and what certifications you have. If you're babysitting, you should discuss with the parent before you begin babysitting, before you begin working for them. Discuss what certifications you have, what those certifications cover, and provide them with copies of those so they know what you are certified to be able to do. If you have an adult or child that is conscious and choking, you're going to first obtain consent, and you're going to stand behind the victim. Bring one arm underneath the chest, over the shoulder. Tilt the victim over so they're parallel to the ground. 5 back blows. Stand them up. Find the belly button. Make a fist. Thumb going directly above the belly button. Other hand over the fist. And push in, giving 5 abdominal thrusts. You're going to continue to do this until the victim begins coughing on their own or until help comes. If you have a child, you're going to be giving the same type of care, but you may need to adjust your height to be able to get into the right positions. If you have somebody that has severe bleeding, you first need to, again, obtain consent before you can give care. Check the scene, make sure it's safe for you to provide care for them. Make sure you're having your gloves on. Once you have the consent, you realize that the person is conscious. You're going to use gauze to cover and apply pressure onto the wound, and then use the roller bandage to roll around the gauze to secure it in place. You want to make sure that it's tight enough to compress and to try to stop the bleeding, but you also want to make sure that it's not too tight where it's cutting off circulation. So check the fingers, check the toes, depending on where the injury is, before and after you begin bandaging. You also want to begin asking the person questions in the secondary assessment. try to figure out any signs and symptoms that may be occurring, any allergies they may have, any medications they take, any past medical history that is relevant, the last thing they ate, and any events that led up to the accident. This way, if you need to have the EMTs come, you have some information that you can give them, even when you're making that phone call, calling for them to come. You give them a little bit of a background so they know what type of care they need to give when they arrive. Fingers.